My name is Mincy. I'm the community manager at Bridge Plus, 79 Robinson Road. I think a lot of us here are members of Bridge Plus, whether you're at 79 Robinson Road or from our friends at Ascent. We also have invited our tenants from our commercial buildings and business parks to join us in this call today with Dr. Noel Yeo. So just a quick introduction to Dr. Yeo. Dr. Yeo has very kindly offered to share a little bit more about the current COVID-19 vaccination. I think COVID-19 vaccination is something that's on top of most people's minds today, it being a worldwide pandemic. In fact, that's that's also a reason why we're doing this webinar doing this virtually. But in any case, don't worry guys, the vaccination is here. Having said that, I think I will not try to talk too much about things that I'm not so familiar with. So I'll leave Dr. Yeo to shed a bit more light about this. So Dr. Yeo, please.
Okay, thanks. Thank you, Mincy, for inviting me to today's session. So, good afternoon, everybody. My name is Noel, and my surname is Yeo. So you can remember me quite easily because I'm born on Christmas Day. So that's why my name is called Noel. Nothing original. So most people don't call me by my surname. So most of my patients call me Dr. Noel. Somehow it seems to work better. So on the screen would be the QR code for my LinkedIn. Generally, I use my LinkedIn to connect with people professionally, and I've been sharing updates on health-related matters recently about the pandemic and about COVID-19 vaccination. So if you like, you can feel free to connect with me on LinkedIn, and you can follow me to see the updates. So let's jump straight into today's session. Probably won't dwell too much on this, but I thought it's important for you to know what I do in my at work, so that you can probably appreciate why I know a little bit more about COVID-19 vaccination. So yes, I'm now running the operations for this organization called IHH Healthcare in Singapore, but I think it's better known in Singapore as Parkway Health. So we have some of these hospitals within our group. The ones that you probably have heard of would be Mount Elizabeth Novena, Gleneagles, as well as Parkway East, or formerly known as East Shore. And we also have a chain of clinics. It's called Parkway Shenton. So these are the group of medical assets that I operate within this group. And myself, I guess some of my hobbies would include doing volunteer work. So that's why I mentioned that I also serve in the CDC, which called the Community Development Council. Also on the complaints committee for the Singapore Medical Association, as well as I serve as EXCO on one of the nursing homes in Singapore. Okay, so the bottom part, these are some of the social media with which I'm on. Generally, you can look for me using my handle name. It's always the same, Dr. Noel Yeo. So I'm going to skip past the Mandarin part. But you notice why the slides are designed this way with both English and Mandarin is because I speak to both sets of audiences. I've recently done this same talk in the community about a week ago. I was at the Bukit Timah constituency with Miss Sin Ant, and we spoke to the seniors who were age 70 and above. As you know, on Monday we started to vaccinate seniors who are above that age group, and we're starting to see more uptake. So I will go quite briefly to discuss COVID-19. I don't think I want to talk so much about the virus and how it started. We all knew where it came from, where it was first detected. Origin is still largely unknown at this point in time. Who was the animal who passed it on to the humans? Nobody knows at this point in time as well. But we all know that it resembles what 17 years ago, that very serious epidemic called SARS, right, where many of the healthcare workers in Singapore passed away as well. I think what is of note is the development of vaccines. And really, I think people are pretty much wowed by how fast the vaccine is being produced. I'm sure many of you have this question about the speed of development. It happened within 10 months. Then Pfizer, BioNTech came out with that first vaccine, the mRNA vaccine. I would say that, well, it's not the first time that we have been, or the mankind has been very fast in producing vaccines. In fact, in the 60s, that was something like 60 years ago, we already have a very strong technology at that time, and they managed to produce the mumps vaccine within 4 years. Okay, so 4 years probably sounds very long in present terms, in present day. But if you think about it, that was 60 years ago. So after 60 years have passed, right, I think we should find that it is reasonable for mankind to have, to have progress in technology, in medical science, to be able to do what the scientists did today, which is to produce a vaccine within 10 months. So I just wanted to put this point across to all of you, if you have some doubts about, or some doubts about the speed of development and whether that correlates with the safety aspect. So I think coming straight to what Singapore has been doing, we know that more than 250,000 of people have received the first dose, and we have started the vaccinating those who are 70 and above from Monday, and it seems like we'll move quite fast into the next 60 to 69 age group by maybe in about 2 to 3 weeks time. And for the general population, it appears that it can be as early as end April for all of you here to be offered the vaccination. So I want to touch on this is my own personal perspective, the 4 main reasons why I encourage vaccination. So these are the 4 bullet points, you can read it, but we need to stress on the first bullet point, which is comparing the risk. So many people, including my own staff, talk to me and describe their fears, right, about the COVID-19 vaccine. They say that if I get vaccinated, I would have a risk of suffering the side effects. If I don't, I have 0 risk. I mean, okay, right? That one is maths. Everybody know. You take a piece of of prawn, you have a risk of developing allergy towards the prawn, right? But then I think in this case, it's not about eating prawn, right? In this case, right, we are considering the risk of us getting infected by the virus. And you know how dangerous this virus is. This virus is not going to sit there and wait for you to look for it. In fact, it's the other way around. This virus is what we call a hunting virus. It goes around looking for hosts, to infect, and it spreads really fast, isn't it? We all can see over the past 1 year how many people has it infected. Something like 104, 105 million and more. And what is the death rate so far? About 2.4 million people has died. So the risk of death, right, in this particular virus is something like 2% or so. It's actually quite a high fatality rate. So you should be comparing the risk of vaccination against the risk of being infected. Right? That is the comparison, the correct comparison to make. Okay, and we have the data that has been released so far, right? So the risk of complications, suffering complications from COVID-19 infection is very, very high, right? So first we start at death rate. Earlier on, I said about 2.4 million, 2.5 globally. So that translates to around 2%, which means that if you have 1 million people getting infected, it's about 22,000 people would die from it. So remember this number first. But coming to the risk of vaccination, the risk of vaccination is mostly developing allergies, right? Allergic reaction. That is the dangerous part. And I just read an article by this Miss Salma Khalid this morning. She said that the US data has shown after they vaccinated more than 17 million people, that the risk of developing allergic reactions is between 2.5 to 4.7 people per million. All right. So remember, I said that the fatality rate is 22,000 people per million globally. But in the US, after they're vaccinated people, the risk of developing allergic reaction to the vaccine is 2.5 to about 4.8, 4.7 people per million. So now we are comparing like for like. The denominator is the same. So I think it's quite straightforward, isn't it? That the risk of death is so high, 22,000, but the risk of getting an allergic reaction against the vaccine is 2.5 to 4.7. To me, very straightforward. My decision is thus made on the analysis of benefits against risks. So I think this very first point I put forth to you, and you will know why we should be going for the vaccination. Okay, so that covers the first point. I think the second point is very practical. It's about the supply shortage globally. And you will read that all around the world, WHO, World Health Organization, is complaining not enough for everybody. You know, we are forgetting the countries that are, you know, underdeveloped, not able to afford, low income countries. But even among the high income countries, this is also not enough. So although our government has, you know, very much boldly made a promise that all of us in Singapore, long-term residents as well, we will receive the vaccine within this year. I think that is simply on the basis that there were contractual agreements, and this one really must praise our government for having the foresight to establish all these contractual obligations. But what if the shortage becomes worse? What if certain countries decide to stop exporting vaccines? I think all these are risks that can happen anytime. So I just wanted to make this point to say that if you were offered the vaccine while stocks is still present, please, you should consider that. Then the third point is something that has becoming more and more talked about among, you know, in the news and among people. Vaccination, vaccine passport, right? People talk about it. And we also heard about certain countries already lifting travel restrictions for people who are vaccinated. I can give you some examples. There's some East European countries, Georgia, Estonia, even Greece. Greece have already made the decision to do so. Poland and Iceland. Iceland also have recently announced that maybe coming to a nicer place for tourism would be the Seychelles, right? Also have mentioned that they will lift travel restrictions. And one of the countries that started to sign agreements with all these countries that I just mentioned would be Israel. As you know, Israel is probably the most successful country in the world to have vaccinated majority of the population. So I think it's going to be a reality pretty soon. Even though there are some talks about, oh, there's social discrimination against people who are non-vaccinated, but we're talking about safety here, you know, talking about public health safety. So if I'm running a country, I think maybe put yourself in the shoes. If you are managing a country and you're the government, would you be putting up restrictions against people who are not vaccinated? I think it's an obvious answer. Or maybe would you continue to quarantine these people who are non-vaccinated? Would you continue to test them regularly? I think the answer is also very obvious, isn't it? So one of the incentives of getting vaccinated is that it might potentially be giving you access to travel more frequently, right? And the last part, that is what I've just mentioned. The last part would be regards what Minister Lawrence Wong have mentioned. He said about a month ago that for people who are not vaccinated, additional swabbing, blood tests might be imposed on these people. So these are the 4 points that I thought would be important for me to start today's session. Now I will come to the second part, which is regards what are vaccines, right? So this picture shows you the 4 different types of vaccines that are the 4 different technologies used to produce the vaccine. We talk about mRNA because this is the one that is currently in use in Singapore. We have 2 mRNA vaccines, one by this Pfizer-BioNTech, the other one by Moderna. There are some little differences between both of them, but generally the effectiveness is about the same, 94 to 95% from clinical trials. So this biggest question about mRNA is does it alter your DNA? All right, because people are worried that it injects into your cells, it affects your DNA. So the answer is it doesn't affect your DNA. And why? Because this mRNA is injected into your body, into the muscle cells. The muscle cells absorb it. The mRNA only goes inside the cell, into the cell. It doesn't enter the center, which is the nucleus of your cell. It does not enter. And in the nucleus is where all your DNA is contained. So because it doesn't enter, it doesn't affect anyway. And mRNA also is something that is not, it's something that's very common in your body. Your body produces RNA all the time. Your body produces RNA from the nucleus of your cell, and it is an instruction booklet. It is like a piece of memo that you send down to your cells to tell your cell what to produce. Make this protein, make that protein. So what the scientists have done very cleverly is to replicate this process that we already have in our body, in our cell, right? So they produce this cookbook. It's an instruction book on teach your body what to cook, what to make. So this injection goes into your vaccine goes through the injection into your cells. It tells your cell to make that particular protein they call spike protein. This protein is found on the surface of the virus. So this protein will then trigger your body to make an immune response. So it will tell your body to produce antibodies against this particular protein. It will also teach your these immune cells, right, to recognize it, so that next time when the virus comes in your body, your immune system will respond quickly, produce a lot of antibodies, attack the virus and kill the virus. So that is how mRNA works. It does not affect your DNA. So all that talk about X-Men and Ninja Turtle, all these are just rumors. Okay. I also want to talk a little bit about the other types of vaccines. So you heard of so many types of vaccines. You also heard about the Oxford, the AstraZeneca one, which is a viral vector. A viral vector means that they utilize a cell from an animal. I think in the case of AstraZeneca, if I'm not wrong, they utilize the chimpanzee cell to produce these viral-like particles for you to make the vaccine and to be injected in your body. There are other technologies which are traditional, would be the whole virus, which means you take a virus, you kill it, and then you inject it into your body, as well as a protein subunit. All these are different technologies. But why mRNA is the latest is also because it has been there for a while. I think the technology existed since the times of SARS, as well as the times of H1N1. But you will ask, how come it wasn't employed? Why didn't we use this technology much earlier? It's because there wasn't a need to. SARS ended within months. H1N1 also no big deal after a while. But this time is a big deal. This particular COVID-19 is so serious. In fact, so many people around the world, so many people die, countries close borders, and economies are affected. So as a result, you have the governments working together, putting in resources. So this technology exists, number one. Number two, this technology is synthetic. So totally don't depend on the virus at all. You are using different parts, different substrates to form the RNA. And because it is made by us, right, made by humans, right, that's why we can make it so fast. That's why we're able to produce it within 10 months. The second reason why we can produce the vaccine so fast, right, is also because the place is just burning. That means the whole world is burning with the virus. So many people getting infected. You have so many people willing to become volunteers for the clinical trials. Because usually in peacetime, when there's no virus around, no infection, who wants to be a volunteer? Nobody really wants to do so, correct? So in this case, because you had so many people getting infected, you have many volunteers, brave people stepping forward, which we got to thank for. So there was enough data for the scientists to work on to be able to prove and manufacture the vaccine as a result. And the last reason why mRNA technology could advance so fast this time is because of money. Because of, I told you, of governments working together, governments funding the scientists, and therefore research was able to advance. And that is why mRNA become something like a mainstay during this time. So I hope that helps you to understand what this mRNA vaccine is all about. So I think this part I'll skip through. We know that Prime Minister has received, this is an article about my organization, IHH Healthcare Singapore, or Parkway. So these are some of us who received it earlier on. Maybe I wanted to share a little bit about what is our success rate now, or how many of our employees have taken up the vaccination. As on 19 Feb, the data is that we have about 83%. So we have total around more than 8,000 staff, and about 7,002 have received the first dose, and now we are trying to close up and complete the vaccination for them. So we have about 75% of our staff having received the second dose, and that also includes me. So I'm going to come over to the Q&A very, very fast, but I think maybe I will maybe go back to this. I wanted to share that my confidence in this vaccine. So the picture on the right side, that's me on top, but the person below, this is my wife. So my wife is also a healthcare worker. I just wanted to point out that I think this is the amount of trust that I have in this vaccine, and the safety profile of it, that I would encourage my own spouse to also go for the vaccination. And in fact, my parents-in-law, they are residents of Tanjong Pagar constituency, so they have also gone for their first dose. All of them are feeling well. I think don't see much side effect. So my personal experience after receiving this vaccine was the usual. I have some injection site soreness, some discomfort. My first 2 days, I was feeling very tired after the vaccination, and beyond that, I'm back to normal. In fact, I made quite a few posts on social media to show people day 1 after vaccination, day 2, day 3, what I did. I was able to exercise. I was able to resume my usual duties. So it didn't really affect me significantly. Like I said, I just felt a bit tired, but that's normal because your body would be producing a response against the vaccine. That's why we will feel a little bit tired. So I think give you a good summary about what I thought about the vaccine. I'm coming to the common concerns about the COVID-19 vaccines here. So yeah, bring on Mingqi. And I know that thank you for the questions that you have brought up to the organizer prior to the session. So I did look at some of the questions, and I figured that this questions 1 to 5 here, and the next slide, questions 6 to 10, would have covered more than 80% of what you all been asking. So Mingxi, how should we do this? Should we have maybe I should just ask people to ask questions.
Yeah.
Be more fun and more interactive.
Yeah, I think if anybody wants to ask questions, feel free. In fact, I have received some questions in our webinar chat already.
Oh, webinar chat, okay.
Yes, correct. Okay, so I'm just reading this out. Anyway, thanks so much, Dr. Yeo, for sharing. I think our team here also thinks that the sharing has been very insightful and engaging. In fact, we're very, we all wish we could get some special powers from it. Maybe not Ninja Turtle, but maybe more of X-Men. But unfortunately, that's not gonna happen.
No, it's not.
So going back to the questions that people have been writing, I'm just gonna read this out. Hi, Dr. Yeo. I am not so worried about side effects, but more on the efficacy of the vaccine. MOH has said, I think, it will roll out vaccination with 50% efficacy, but if compared with other vaccines such as chickenpox, etc., it is very low. Will there be any implications or more risks of such low efficacy?
Okay, good question, and thank you for that. I think first to take a step back, right, and we looked at the types of vaccines that we have here. So we have 2 types, as you all know, the 2 mRNA vaccines. During the phase 3 clinical trials, the effectiveness of these 2 vaccines, right, were found to be between 94 to 95% of protection. And what was proven is that it protects people from developing symptoms as well as complications, and reduces or prevents the need for hospitalization. That was what the initial study was looking at. So what it just means is that out of 20 people who received the vaccine for both types, you only have 1 person who will need to be, who have developed symptoms if you come into contact with the COVID-19 virus. So that is what it means. So I would say that is actually a very high, very high efficacy rate. In fact, it's not low. I'm not sure about the 50% efficacy here. I know that there's some variable studies that has been produced from the China manufactured vaccine, the one called Sinovac. That one has some variable results because it was tested in several countries. But I think there was a lot of highlight made to the results from Brazil, because the Brazil site has informed and released the data which showed just about more than 50% effectiveness in preventing illnesses, right? That means preventing symptoms. But it did still say that it reduced significantly people from being hospitalized, and that's actually what is most critical. That means what you're saying is that if I give you a vaccine and I'm able to reduce the response, that means your body's response to it simply down to a flu, right? So it will be like a normal flu. Because what the country, what healthcare systems are worried about is to have many people get sick from COVID-19, requiring to be admitted, requiring ICU care, requiring ventilator support, requiring intravenous drugs and all that to keep you alive. That is the problem that governments want to avoid, because it totally stresses out the entire healthcare system, and it's not sustainable for long. So we are very lucky that we only have a very short period of time where we have so many cases. As you recall us last year, between March to April, where the National Center for Infectious Diseases cannot cope. And that's why they had to look towards the private hospitals to accept. So my hospitals right in my group had to open up certain wards to help to accommodate the stable patients from NCID, so that they would preserve their capacity to look after people who need critical care. So then thereafter, government started to create those community care facilities for stable patients to go over, because there are just so many dormitory workers being infected, but the majority of them are so well, isn't it? So I think back to the point I'm trying to answer is that maybe let's look at that efficacy from the perspective of preventing serious illnesses, preventing yourself from being admitted to the hospital. I think that is perhaps the key that we know for sure that the vaccine will work against that. So I hope that helps you to answer. But maybe a second part to your answer is comparing to what other vaccines, chickenpox, all that. Yes, very, very low. Will there be implications of this? I think we are looking at it from a perspective of public health. And what we are worried is that if we don't give people this protection and pass the critical mass, right? We're always talking about what, 60 to 70%, some people say 80% if the virus is at a higher risk of transmission. You see, if you don't vaccinate enough people, then the virus, right, will jump from host to host. It will also develop in reservoirs, hidden reservoirs that you do not know of within the population. And when you give the virus a chance, right, to have a host, and it starts to replicate, that means it starts to multiply itself, that is when mutation happens. And when the virus mutates many times, then the effectiveness of your vaccine will become lower and lower. We are lucky now that the vaccine still triggers sufficient antibodies, sufficient protection against the existing virus, even those variants that we heard about, right? We heard about the top 3 famous one, the one from UK, the one that from Brazil, and the one from South Africa. These 3 are the top 3. The vaccine, fortunately, still produces sufficient protection to prevent serious illness and the need for hospitalization. This is proven, okay? And that's why we need to give people the vaccines quickly so that we can achieve sufficient critical mass for protection. Then we can stop the virus, right, from multiplying itself, from replicating. Then we can stop more variants from being produced. So I hope that helps to share the big picture, why vaccination is used as a tool against the virus.
Yes. Okay, thank you. Another of our attendees also is also asking a question. What tests are done to determine if we are suitable candidates for the vaccine?
Okay, so we don't do we don't do diagnostic tests. What we do, right, from a medical perspective is to have a medical screening. We do assessment in the form of finding out your past medical history. From the studies, right, that has been released so far, that's why we found that there are only several types of what we call contraindication. It just means that what are the conditions that stop you or restrict you from taking the vaccination? And it would be, number 1 is your age. So those people 16 and below for Pfizer BioNTech, for Moderna is 18 and below. They're not recommended for the vaccine. Second group will be those who are pregnant, also not recommended. The third group will be those who have an autoimmune or immune related disorders. Those people are also not recommended. And the fourth will be people who have history of severe allergies or against multiple types of substances. So these are the four conditions that if you have, you should not be going for it. But I think let's touch on the first three. I wanted to clarify that it's not, we are saying that if you have these three conditions, you don't go for it. It's not because it's unsafe for you. It's because, right, there's no clinical evidence to suggest that the vaccine works for you. It's because also during the phase 3 clinical trial, there was the candidates, that means the tens of thousands of volunteers who go for it. None of them was less than 16 or 18 years old. None of them was pregnant. None of them had the autoimmune or immune disorders. So the scientists therefore cannot confidently say that they have tested and they suggest for you to receive the vaccines. So it's just a matter of evidence, clinical evidence. The fourth one being the allergy. That's a result of, like all drugs, right? If you are allergic against Panadol, I won't give you Panadol. If I know you're allergic to many drugs, right, of course I'll be very cautious and worried if I were to give you the vaccine. So that's why it's highly recommended for those who have multiple drug allergies or severe reaction. Severe, we are very worried about swelling. We are worried about individuals who had that history of swelling, especially in the throat, in the face, because we don't want people to receive the vaccine and then have an allergic reaction and compromise your breathing. And that is very serious reaction. But actually for those people who have maybe 1 or 2 allergies and their allergy is itchy skin, a bit of headache, I think those still pretty much okay. We have individuals who went for it. In fact, I spoke about my wife. My wife has Panadol allergy. She also went for the vaccine. That's fine. And that is why, right, we have that 30-minute post-vaccination observation as part of the protocol. We were picked up in fact, I think more than 99% of any reactions will be picked up within the first 15 minutes post-vaccination. So to be safe, our Ministry of Health recommended monitoring post-vaccination people up to 30 minutes. So it's pretty much very safe. So I hope that helps you to understand. So we don't go and do multiple blood tests and all that to test suitability. It's more from the understanding of the people who have gone for vaccination. These groups of volunteers, they are all well, they're healthy after that. Then now we start to inject the vaccines in larger groups in the real world, and there have been data that's been collected post injection as well. So there's been all sorts of monitoring happening, and the safety profile has been pretty much comparable to what was in the clinical trials. So it is generally a very safe vaccine. And I repeat what I said earlier. From the US data, out of 1 million people injected, only 2.5 had allergic reaction to the Moderna one. 4.7 people had allergic reaction to the Pfizer-BioNTech. So it's very small group of people. Out of 1 million, maximum 5 people will develop. So I would say the risk is very low.
Okay. Actually, on that note, some people have also emailed us questions relating to the profile. So someone has asked, is it safe for breastfeeding mothers?
Yes, it is safe. However, it is also recommended that post the receiving of the vaccine dose, we will say to hold off breastfeeding for up to 7 days. Between 5 to 7 days will be safe. I would suggest to stop breastfeeding for 7 days. And to maintain your breast milk flow, please use the mechanical pump to keep the milk flowing. But don't breastfeed your child for that next 7 days. I think your child can go on a breast milk holiday go and consume powdered milk for a while. Because you think about it, it's also safer for you as a breastfeeding mom to be vaccinated. I think it's worth to it's worth to not give the breast milk for about 7 days in order for you to go ahead with the vaccination. Because you have to know that if you protect yourself, you'll be protecting, in a way, indirectly protecting your child. Because your child have no way of receiving the vaccine at all, right? There's no vaccine yet for babies. So therefore, I would strongly urge nursing moms to consider.
Okay, and just now you were talking about the different brands of the vaccination. That somebody actually wrote in to ask, is there one that is better than the other?
Okay, that's also a good question. Let me move back, see whether I can trigger some of the slides. Just 1 second. Okay, it's a very small picture here, but you look at the lower left part, right, which the title says a look at the 3 vaccines Singapore is securing. So Singapore has secured 3 types of vaccine: Pfizer, BioNTech, Moderna, and Sinovac. The efficacy rate I've already mentioned that both Moderna and Pfizer BioNTech is very similar, 94 to 95% protection. And the Sinovac, which being the third one, is still pending emergency authorization use in Singapore, is the 78% is an average. It ranges from something like 50+% to as high as 80%. But it's a data that is received from different countries, because the Sinovac was introduced as voluntary trials in different countries. So there's some variable results coming from there, and therefore the average is around 78%. So if you ask me, I can answer you based on what the trials have shown that the first 2, the mRNA vaccines, appear to be better at this point in time.
Okay, thank you. So another, someone also asked, is there going to be any kind of is there going to be some sort of documentation to prove that one has been vaccinated?
Yes, okay, so now what is done is, this from my experience of running the vaccination center. What we do is we will keep records of people who have received the vaccination in the National Immunization Record System, which has been introduced just prior to this pandemic. So if you go on to that National Immunization Records, you can log in using your SingPass, and you will be able to see your record of receiving first dose and second dose of the COVID-19 vaccine on there. So that is the national record. There's also a little card that's given to us that says the date of receipt. There's a hard copy. At least I have it. Let me try and find whether I have my card. There we go. I have it. So I'm just going to put down here and see whether you can see it. Let's see. Oh, sorry, my screen is killing it. Anyway, something like that. Yeah. So this is the card that the ministry will give to me. So you have done over. Yeah, it actually states the dates of the first dose and the second dose. But what I heard from ministry is that they're planning to move it entirely electronic, and that is to facilitate future use of these vaccination certificates. Maybe in preparation for bilateral agreements with certain countries who will recognize our vaccination status, so that we can travel freely without need for quarantine if we are well and not sick.
Okay. Okay, we still have quite a number of questions. Let me try to power through them.
Okay, no problem. We have time. Go ahead. Go ahead.
Yes. So we have one. Hi, Dr. Yeo. How long does the protection from the vaccination last?
Okay. The data so far has mentioned that at least in the group of people who were the volunteers receiving the vaccine, post 90 days, right, vaccination, the immunity is exactly the same as just after 2 weeks. So it has not dropped after 90 days. As to whether it will last even further, there's still research going on. Our prediction, the talk among many of the infectious diseases experts, right, would be at least a year. But this is an estimate. Within my own company, earlier I mentioned that we have more than 7,000 of us who received the doses. We are also doing our own real world studies. So what we did is we got a few of us, right, who were willing to go for the blood test. So we had our blood samples sent to the lab, and we tested for antibodies. We look for neutralizing antibodies, which is the specific type of antibodies that will block the virus from attaching to your cell. So mine, I just did it about 2 days ago. I have levels that is sky high, which is way beyond what the machine can even measure. So it proves that I am immune. at this point in time. 3 weeks post vaccination, but I don't know what's going to happen in 6 months time or in a year's time. So I'm going to go for a repeat test in 6 months time and also a year's time in order to check and see whether my immunity is going to be lasting. Then maybe I'll let you know by then. Because I think I'll be about 4 months ahead of all of you, looking at the vaccination phases.
Okay.
So yeah, I probably will be able to answer you in a few months time, but I think estimates are saying that probably about a year or so. But I also wanted to elaborate further on this question is that when you are vaccinated against the virus, right, your body has recognition, right? Your body already knows this virus first time. And suppose your antibodies levels start to fall and to the point where that you are no longer protected, the next time that you get into contact with this virus, either through a booster dose or through the virus itself, I guarantee you your system will respond very, very fast, right? Because you already have memory cells. Means your white blood cells, they are a special group called memory. They recognize this particular type of virus, and they will react very, very fast the next time they come into contact. So that in itself, right, will improve your immunity, and this is something that is a theory that is proven in many other viruses. So this thing about memory cells having this recognition and to be able to trigger a faster immune response the next time you get it. So I think we are also depending on the memory protection in future. I think at this point nobody really knows because the virus is so new. Data is limited, but I think looking at past viruses, past diseases, right, there is some form of protection because of your memory cells. So I hope that helps.
Okay, yes. Okay, we have another question. Can Dr. Yeo share his experience after he did his first and second vaccine? I think everyone's very curious to know how it feels like from a first hand.
Yeah. I saw that question. So that's why I put up this QR code. Because right, if you can go to this QR code, but I think maybe this QR code is for LinkedIn. LinkedIn not so easy to scroll. If you really want to scroll through, right, maybe suggest you look at my Instagram. My Instagram is easy to scroll because you can see all the little blocks of photos, right, and videos. You scroll down to January because I took my first dose. I think I took my first dose on the 19th. If I'm not wrong. Let me see. I took it on the 9th. The 9th of January. So if you scroll to that 9th of January, you will see I detail post 9 January. Every single day I made a post. I always say day 1 after vaccination, day 2, day 3. You will be able to see my condition.
Okay.
Then you see for yourself and you'll be convinced because I even put up videos of me going to the gym, pushing myself to do weights and all that, going for runs, eating my favorite char kway teow, etc. Going to work, conducting dialogue sessions with my own staff to convince them, to tell them about my experience. I really felt normal. Second dose also same kind of reaction, meaning that I felt tired. I had some soreness of my left arm because I chose to inject on the left side.
Yes.
But really that's about it now. I didn't feel anything else apart from that tiredness. But I must say quite tiring, meaning that I really felt tired post vaccination, and it's because your body is producing an immune response against the vaccine that's injected. So that's why there's this general sense of tiredness. But it wasn't so bad till it affected my work. I could still work, I could still walk about, I still went to the gym as per normal. But I did feel some slight dip in my overall function. But that only lasted about 2 days. Then I was back to normal.
Okay.
Yeah, I think my wife also felt the exact same thing. I think we know that at least it wasn't a placebo. It works. And that's why we went for the post-vaccination antibodies test, and we are quite happy that we have the protection.
Okay.
Yeah. So go and look at all my posts. I purposely put up all these pictures and videos because I know my own staff and employees are watching me.
Okay.
So they are able to see how I continue to live my life after vaccination.
Yeah, okay, definitely. And actually on that note, because there are also a lot of people who are writing in to ask
Mm,
what are the more common side effects. So from what I hear that you just described, the feeling of tiredness, soreness,
mm.
because I think some people have heard certain rumors about people collapsing. So we're not sure whether that is true, or is that just a rumor, or is that a very minority that we're looking at?
Yeah, I know there are reports out there and I don't know whether we can attribute it directly to the vaccine.
Mm,
I would say that sometimes these are just coincidence. I
mm,
mean, it just so happened like that. There was the elderly gentleman who had a cardiac arrest. Cardiac arrest means the heart stopped, right?
yeah.
On the same day that he received the vaccine. But
Mm,
ministry have come out to say that it's really not related. I mean, after all, the person is very old and has pre-existing medical conditions. So
mm,
I think it's really much coincidental, and we
yeah.
shouldn't be drawing such conclusions so quickly.
Mm,
There has been in Singapore, of course, there has been people who develop allergic reactions, but no one has suffered a permanent disability from it. Everyone who had that reactions, right? I believe they were all given the first aid care on site at the vaccination center, and then they were sent to the hospital for monitoring. People are well. Even among my own staff, in when we were giving the vaccination, we did have some staff who felt unwell, giddiness. So we just have them admitted for observation for a while, and all of them were back to work after 1 to 2 days. Not sure about the MC part. I know Marcus sent this question about can we get MC because of tiredness. This one I leave it to Capital Land and Bridge to let you know. But on my part, in my organization, yes, when they felt unwell,
mm,
we told our staff to visit the doctor because we are a healthcare group. So they went to see our A&E doctor or our GP, and we left it to the doctors to make a professional opinion. We didn't really want to dictate what happens. And I would say that we have this trust culture with your employees. You trust that if they are really unwell, please let them rest.
mm. Yeah, when it's my turn to take the vaccination, I'll make sure to request for MC from Marcus. Yeah.
I hope Marcus is from HR.
Okay. Um, Another question, because I think I just shared with you very quickly before this webinar started.
Yeah.
We actually have a lot of guests who's joining us virtually from our other buildings as well, not just from Bridge Plus or from 79 Robinson Road. So some of our tenants from some of our CapitaLand buildings have actually asked whether the vaccination will be rolled out in April and will it be in our buildings? And I think you have some insights to share with regards to that.
Sure. Also a good question for most of us to ask. I think we are asking it from the perspective of convenience. I think my comment to that, well, it's really left to the policymakers, right? It's up to Ministry of Health to decide whether they would like to send mobile vaccination teams or set up centers within commercial buildings or even other residential buildings. As of now, the strategy that has been announced through the government is to set up 40 vaccination centers around the community, and also to have a team of mobile vaccinators going around. But these mobile vaccination teams are only there to be deployed to vaccinate elderly residents, disabled people. They are those who are living in care homes, in nursing homes, in residential homes. These are the ones, sorry, not the normal residential, but those who are under special care. So they will be going around to do that vaccination. Like my own grandmother. My grandmother is 94 years old. She is staying at one of the nursing homes. I've just visited her on Monday. And she shared with me that she's receiving some injection on Wednesday, which is perhaps today. So I asked the nurse over there, and they told me that yes, the mobile vaccination team is coming down to do the vaccination, but it's very much limited to these group of population who are residing in these special facilities. But for the rest of us, I don't expect that to happen. Why? First is that I think the government has already set up that 40 vaccination centers. Okay, so it's already there. The infrastructure has been set up. So why need to have special arrangements? That's number one. Number two is the logistics. I think we would know that the storage conditions of that vaccine requires a bit of a cold temperatures, isn't it? And we also know that there's a shelf life. So I can tell you that the shelf life post dilution, that means we take out the vaccine vial from the fridge, we warm it up. We need to leave it in the room temperature environment for 30 minutes to warm it up. Then we'll mix the what do you call it, the solvent into the vial, and we will wait for it to be fully mixed up, right? Then so once we dilute the vaccine in the valve, that valve only lasts up to 6 hours. So it really is a challenge for groups of people who are moving in and out of vaccination centers. So it's best done if we conduct vaccination within a facility that is already set up, really because of the storage as well as the short shelf life, right, of the vaccine once it's mixed. And what we call it constitution, once it's reconstituted, we have to administer it within 6 hours. And also, each of the vial, upon mixing, it has, you probably heard, right, 5 doses, correct? Because we heard of the one of our colleagues, my medical colleague at the Singapore National Eye Centre, who received 5 doses by accident. So each of the vial contains 5 doses. So therefore, you also need to consolidate people. It's like in batch, go and vaccinate in a batch of 5 so that you prevent wastage from happening. So there are all these limitations as a result of the nature of the vaccine. So which is why I think the government might be more inclined to have people going to the vaccination centers to get it done. But I assure you that the experience at the vaccination center is pretty similar, at least for the centers that I'm running. So I'm running 3 at the moment. One is the former Hongkar Secondary School at Jurong West. That one is now being designated to vaccinate the people who are in transport sector. I think you see the papers yesterday or today where we have Dr. Amy Call who went down to visit. So they have started vaccinating drivers who are taxi drivers as well as private hire drivers. I'm also running 2 more. One is at Bukit Timah Community Club. The other one is at Taman Jurong Community Club. So in total, I know there are 11 centers operating at the moment. And by next month, end of March, it's going to be 31. And by end of April, it's going to be 40. So you have more than ample choices to go and get your vaccination done. So I wouldn't be too worried about doing it on site.
And as a continuation to that question, will the vaccination for public be rolled out in April?
It would then, okay, I think it depends on a few things. One is how quickly we can vaccinate our seniors. That's why it is done in phases, and seniors will be the obvious choice because of their vulnerability. They have a far higher chance of being hospitalized and a far higher risk of getting complications and death. So that's why they go first. Second is that vaccinating seniors also takes a bit more time because many of the seniors are, while they are able to walk, but they walk much slower, reflexes are much slower, they need more explanation about the vaccine. They really need more time. So our centers now are catering towards the seniors. We spend a lot of time trying to explain to them clearly, and many of them don't speak English very, very well. So we need to have communication done in Mandarin, especially. We also have communication done in Malay, in Tamil, and sometimes in the various Chinese dialects. So you can imagine that it's happening far slower for our seniors. But I believe once we clear the seniors down to the Merdeka, now we are doing the pioneer generation. The next group will be the Merdeka generation. And then thereafter, it will be free for all. And I think when it comes to free for all, it should be pretty fast because the comms, the education is already picking up pace. Everybody would have known about it and they would have made the decision by then to decide whether to take the vaccine or not. So I think it's going to be quite fast once it comes to April. So we are keeping our fingers crossed that it would be ready, or rather all of you would be given the option by April. Yes.
And when that happens, which vaccination will we be getting?
Okay, so now it depends on the center. I'm still not too sure how the Ministry of Health would plan will plan this. But what the assurance that we know is if you receive a particular brand, let's say you receive Pfizer BioNTech for the first dose, the promise from the government is that the second dose will be the same. That's what they've been telling us. That's subject to change, right? But at this point in time, we know we will always receive the same. But we also have know that there's no choice. So I think the wise choice by the ministry, right, is not to tell you which center will have which stock.
Okay.
I think maybe again it's up to policy, but I'm just saying that from my personal perspective, right, I would stock up one center to have a particular brand, this center to have a particular brand, because you can imagine on the ground, right, it's so difficult to administer different brands, and if you administer Salah, right, that's it, we'll have another media issue to deal with. Unhappy public. I think that it's gonna be tough, so it's probably it'll be you probably hear it among the public. Once they go for it, WhatsApp group will then say, oh, I received this particular brand at this particular center. Then everybody will flock over because they want that particular brand. I really hope it won't become that kind of situation. But I expect it might. It's like telling people, hey, the Hello Kitty at this particular McDonald's, right, is the one with the white color dress. That one is blue color. So people will go and choose and run for it. But let's wait and see. It's really left to the policymakers.
Okay, but good to know the insider tip. We have another question. I saw some photos on newspaper. Just curious, how come the vaccinators don't wear gloves?
Okay, good question. I also know that some people will ask. Let me just move back you're right. And yes, we don't put on gloves for vaccination. One is because of the risk. We actually refer to the Communicable Diseases Center in the US for reference. Our Ministry of Health also has guidelines on giving injections and vaccinations. So when we do injections, vaccinations, we generally don't wear gloves because there's no need to. Why? It's because the risk is very low. Why is the risk low? It's because people who come for vaccination or injection generally are pretty well. In this case, vaccination, these are all well people here to receive the vaccine, isn't it? So the risk is very, very low. The only times where we put on gloves to do vaccination is when we look at the skin. That means we'll assess the skin of the person. We see, got broken skin, there's a lesion, there's some, maybe got eczema type of the person, or there's some open wounds, right? And we're going to inject nearby. Okay, then we will put on our gloves mainly is to protect the person doing the injection, not to protect the person receiving. That is the infection control. And if you're worried about whether the person giving the injection will pass anything to the person receiving, the answer is no, because we will have already done our hand hygiene. So between injecting person A to person B to the person C, it is standard protocol for the vaccinator to wash hands, to change the syringes, to change the needle. So we won't use the same thing. So therefore, it's actually very, very safe. And so gloves are not needed. Where it's a bit different is that blood taking. Blood taking is different because you're extracting a blood sample out from the patient. And that is actually, there are fluids, right? You are going to be handling fluids. So therefore, in extracting blood and handling fluids, sometimes like getting urine sample from a patient, those we will put on gloves, all right? Because the risk of exposure is higher. In this case, there's no fluid, right? The fluid is sterile fluid, which is the vaccine. So that's why it does not make sense medically to put on the gloves. So I guess, again, hope it helps.
Okay. Okay, quickly, because it's already 5. So someone's asking, after vaccination, can you still be a carrier of the virus?
Okay, this one yet to be established whether or not whether you have can be a carrier. Really, I still don't know at this point in time. What we do know is that it prevents symptomatic disease, which I told you. It prevents hospitalization as a result of the infection. There actually is some data that has came out from Israel. You can go and Google Israel and transmission of COVID-19. And you find that Israel, they have put up some real world data because they have vaccinated so many people. They studied about 600 over 1,000 people who have received the vaccination versus 600,000 who have not. and actually found that there is some suggestion that there's prevention of transmission. So when there's prevention of transmission, it answers your question that actually vaccination stops you from becoming a carrier. But yes, there is perhaps some real world data coming out soon. So we just wait and see.
Okay.
I wouldn't worry so much about it because I think you see, the point here is that if we get ourselves vaccinated, we are protected. Your neighbor also gets vaccinated. Everybody gets vaccinated. Rather, a big significant group gets vaccinated. All of us would be protected in a sense. And so even if we do carry the virus, we pass it to another person, and the person would just be developing very mild flu symptoms. I recall at the start of the session, I already said already, what is important is to reduce hospitalization, reduce complication, reduce death. But if it'll be a bonus if it's proven later on that there won't be any carriers, and it doesn't, and it also prevents transmission. That will be a big bonus for the vaccines, and that's what scientists are trying to prove at this point in time.
Okay. The next question is that will my dependents be able to go for the vaccination with me when it's rolled out to public?
Depends on how old they are.
So it's still dependent on the audience target.
On the criteria, that is set by ministry.
I see.
I have some good news is that the Sinovac vaccine is being tested on children 3 years and above. So that's good news. I mean, if Sinovac comes up with data to support that children above 3 years is safe for them to receive and it triggers effective protection, then I think Sinovac will become the default for kids. It's a potential development.
Okay.
The other thing that I also read recently is Pfizer-BioNTech vaccine is also now being tested in pregnant women in their second to third trimester.
Okay.
You can Google, it is already starting to be tested, and if proven that it works, then pregnant women can also receive the vaccine without worry. So there are tests that's now been carried out on these initial groups of the population who were excluded from the study. Now we found volunteers that are willing to do it. We test them and let's see how it works.
Okay. Someone told me to, I'm just reading off, right? Someone told me to take 2 Panadols before going to vaccination. Is it the right way to do so?
I generally feel that there's no need to. I didn't even take a single tablet of painkiller over my 2 injections. So I don't recommend that. But if you're the type who has history of migraine, you're worried that the pain will, the injection pain might cause you to have headache, then why not? It doesn't harm you in any way. But I won't recommend it as a default. Suppose you're healthy, you don't have a history of headache, you can tolerate pain very, very well. I don't feel there's a need for you to get to take Panadol beforehand. Really no need to. You won't even feel it. The injection is not the injection doesn't cause any pain because the needle is so thin, so small. It's later on, about 12 hours later, then you'll feel the response by your muscles, because your muscle will have absorbed the mRNA, and then it starts to trigger immune response. Then that's where you feel the soreness. So the soreness is not because of the trauma. It's not because of the needle poked into your arm. It's because of the vaccine and the reaction by your body trying to develop antibodies. Then you'll feel soreness.
Yeah. Okay. We just have 2 more questions before we wrap up.
Okay.
The next one is, hi, Dr. Yeo. I have a mild allergy to ampicillin. Is it safe to take the vaccine, and what are the implications?
Yeah, you say mild allergy, isn't it? So I think I would assume that your allergies, first you have a single allergy, so that's only one allergy, so the risk is lower. Second is that you mentioned mild. It depends on how mild it is. If you're telling me it's nothing to do with swelling in your in your nose, swelling in your throat, then I would say it's not a problem. You should go ahead and take the vaccine. And maybe on your question, let me expand because a lot of people always ask, if I have history of high blood pressure, you have diabetes, so and so forth, is it okay? Answer is yes. Please go for your vaccine. The vaccine doesn't affect your existing medical illness, neither does your medical illness affect the vaccine. So no problem at all. Some people also ask, if I'm taking chronic medication, taking for all the diseases that I just mentioned, and some people even ask if I'm taking blood thinners, is it okay for me to go for the vaccination? Answer is yes, it's okay. Why? Because you are taking blood thinner, you go for regular blood tests. Needle poke you to draw blood. Same thing, what? We're just piercing your skin with a needle to inject the vaccine. So no problem at all. It's totally safe. It's fine for you to go for vaccination.
Okay. And the last question is, Dr. Yeo has shared the adverse reaction in US. Are there any similar data reported yet in Singapore or other countries?
Yes, there are. There's definitely there will be reports of allergic reactions. It's just whether the ministries of the different countries review the data. So I quote the US because US, they're very forthcoming in announcing their allergic reaction rates. I think Singapore also have, and Singapore should be announcing soon. I roughly know the numbers, but I'll leave it to the ministry to review. I think it's better done through official channels. And it's very similar rates to US, very, very low. So that's why I can confidently tell you that it is a very, very safe vaccine. Not any different from eating peanut and getting allergic reaction, or eating tiger prawn and getting allergic reaction. It's the same one. Every time you put something in your mouth and swallow, right, you're already taking a risk of developing an allergy. Yeah. And you wouldn't know. And because you don't know, that's why we would have that 30 minutes of post-vaccination observation for everyone who received the vaccine. That is the safety measure that we put in place.
Okay. Thank you so much, Dr. Yeo. I think we've taken out enough of your time. So really, really grateful that you shared these insights with us, and hearing all these things like viral factors, vectors, and mRNA, taking us back to biology class, but I think you managed to break that down into very layman terms for us to understand and appreciate. So we really thank you for that. I think we'll come to an end for this session. So for the rest of our guests, we actually have a poll. If you could, please just participate in the poll before we end this session. And yes, thank you again to Dr. Yeo. Thank you very much.
Hey, welcome. Thanks, Mingqi, for hosting me. Thanks to everyone also for attending. Like I said, if you need to have further queries answered, then feel free to approach me on the social media. I'm quite responsive, so you should be able to get some questions answered quite quickly.
Yes.
And I really hope that you will consider this carefully, and sign up for it, really, because it protects you, protects your loved ones, and also Singapore. We are all in this together. You can think of the vaccine like a bulletproof vest. You need to wear the bulletproof vest, right, in order to defend our country. And it really, you have to think about those of you who have children at home. At this point in time, they can't take the vaccine. So you think about them. If you want to protect them, you need to step forward to take the vaccine, so that we can all form this great wall of Singapore, right, to fight the virus and don't let the virus come into our country. Okay? Yes,
100% agree with you on that. In fact, for Bridge Plus members, I hope all of you have received your Bridge Plus mask, which is this. If you haven't, please come and approach your community ambassador. Thank you very much, Dr. Yeo. Really appreciate having you around, and we will definitely reach out to you if you have any questions on your social media platforms.
Okay, and thanks so much. Thanks for inviting me. Thanks.
Thank you, everyone.
Take care of yourself. For those Chinese, 恭喜发财.
恭喜发财. Happy New Year.
All right. Bye-bye.
Yeah, bye-bye.